day everyone, I am Leika Denise Desamito, your student midwife from BSM 1B.
And I'm Alea Mae Halabaso, your student midwife from BSM 1B.
And I am Arabela, your student midwife from BSM 1B.
And today, we are going to perform or demonstrate Leopold's maneuver and EINC.
What is the purpose of doing Leopold's maneuver?
The Leopold maneuvers are used to palpate the gravid uterus systematically. This method of abdominal palpation is of low cost, easy to perform, and non-invasive. It is used to determine the position, presentation, and engagement of the fetus in utero.
Provide privacy.
Hello ma'am, good afternoon. I am Leika Denise Desamito, your student midwife from University of Ilocos, Philippines. So ma'am, for verification po, may I know your name and birthday?
Good afternoon po, ma'am. Kailan yung hadlock and December 4, 1995.
So ma'am, that's alright. How would you like me to address you?
You can call me Jhem.
So ma'am, allow me to explain the procedure that we will be doing today. So our procedure is called the Leopold's maneuver, and it means that it has 4 maneuvers or 4 grips. And this is important for us to know the fetal presentation and fetal lie of the baby inside your womb. So is that okay with you, ma'am? So before we start our assessment, you can first urinate in our restroom so that there will be no discomfort once we start our assessment. So the first one, we will be doing the proper hand washing to avoid any cross-contamination of microorganisms. So in this case, it is necessary to use warm water. Allow the pregnant woman to lie in a supine position with slightly knee-flexed and provide a small pillow and put it on her back so that it will not cause any supine hypotension syndrome. Allow the student midwife to remove that one and expose the belly of the patient.
The first maneuver or the fundal grip.
So the first maneuver or fundal grip will be assessing for the presentation of the baby or fetal lie. So we're going to be assessing if it's breech or it's phallic. You can see that it is breech if it's round, if it's hard, and if it's movable. But if it's round, soft, and immovable, it means it's a phallic. So the student midwife will be facing to the client and will be forming a triangle. So the midwife gonna palpate right there and observe for the necessary findings that she said to her earlier.
Fundic height measurement.
Now, they'll be using a tape measure to identify the fundic height measurement of the baby. They will be using the centimeter part, so the zero line must be superior to the symphysis pubis, which is located there, and they're gonna be following the abdominal curve. Remember that it must be the abdominal hand.
Second maneuver or the umbilical grip.
For the next grip or the umbilical grip or the second maneuver, they're gonna be palpating on the sides of the uterus. Now in there, they're gonna be determining the fetal's back because it is important for us to know where we can auscultate the fetal's heartbeat. So are the fetal's heart rate, so it is important because they will be placing the stethoscope there later on to determine the normal heart rate of the baby, which is 120 to 160. Now, they will be palpating right there. So, observe that their left hand will be stationary for a while their right hand is moving, so palpate it from the top to bottom and vice versa. Their right hand will be stationary for this time and their left hand will be moving again from top to bottom. You can determine determine the fetal's back because it is flat, has a resistant surface, and it is hard. But if you palpate any angular nodulations, it means that it is the lower extremities of the fetus or it is the elbows and knees.
Third maneuver or the pollex grip.
Now, let's proceed to the third maneuver, which is the pollex grip. So, in here, they will be forming an L shape on their hand, which is their index finger and their thumb. So, they will be placing it right above the symphysis pubis of the patient. So, they will be putting it there and they're going to observe the degree of engagement. So, if this moves when you move it from side to side or when you move it upward to lift up the head, because some other institutions do that, the fetus head is not engaged. But if you move it and it's movable, it means that it is engaged.
Fourth maneuver or the pelvic grip.
So, for the last maneuver, they're gonna be doing the pelvic grip. So, this is the fourth maneuver. So, the first, second, and third, we are facing the client, but for the fourth maneuver, they're gonna be facing its foot. They're gonna be starting there and gonna have approximately 2 inches on the inguinal ligament, and they will be palpating it downward motion through the sides again. This is also somehow to confirm the second maneuver, which is the umbilical. In here, they're going to determine or demonstrate or assess the degree of flexion. They're going to palpate it. Remember that a well-flexed head is right opposite to the fetal back. Once you're done with your assessment, make sure that your patient is in comfortable position. Don't forget to do hand wash and note any unusual findings or any findings that you have found on your patient. We hope that you learned and understand something in our demonstration. Thank you for watching. Bye! So the first one, from the top and vice versa.
Eat medicine that's out of date. Using
Now,
dumb ways to die. So many dumb ways to die.
in a comfortable position.
Ways to die. Dumb ways to die.